one of the most important things I think that came out of this for me was terminology. We say no code or do not resuscitate. And every kind of healthcare directive, living will, 5 wishes, whatever you want to call it, has those words in it, that someone does not wish to be resuscitated. What it doesn't tell you is the nuance, that the medical community and the physicians in this particular hospital found a way around that by calling this a chemical code. So when his father's heart began to fail, rather than letting it simply do that and letting him reach the end of his life through natural means, they used medication to change the rhythm of his heart to keep him going. We questioned for what purpose, because it gave him more days of being in this comatose condition on a respirator with everything in his body failing. But now that his heart had been changed to a more stable place, at least that wasn't stopping at that time. So I think what a healthcare directive needs to say very specifically is not only do not resuscitate, and you check that box or circle that part of the form, but you need to add the words in, no chemical code. And I think that makes it even clearer that the physicians need to not use the means that they may not consider resuscitation.
And if you run into healthcare providers that are not being sensitive to your responsibility as the person who has been given the difficult choice to make decisions to not resuscitate, and you aren't getting the kind of feedback that you think that you ought to be getting back, what do you do? Who do you go? What's the next step up the chain of command to insist that your wishes for the person who is under care are in fact honored?
I think it's
and how long do you wait?
I think it's important to find out information from the direct caregivers, and those are the nurses. In this instance, we had at least 4 or 5 different physician specialists who were involved. There was the surgeon, there was an internist, there was a kidney specialist, there was a pulmonary person. There were all these different doctors, each with their own special knowledge, and they were trying to work with one another in a distant way, but each of them was responsible for his or her own little piece of the picture. There is not necessarily always one physician in charge. All of them were in charge of something. But I think from one physician, it's very important to be quite direct and to say, I would like to know what you expect the outcome to be. I did ask that question of the surgeon at one point. And I said to him, I'm not sure what you expect the outcome to be, but I'd like to hear from you what you think are artificial means of keeping Joe alive. He couldn't get out of the room fast enough. This was a very uncomfortable area for him. Once there's enough information to know, then you have to ask another question. What do you think the outcome would be if you keep him going? And if you don't get a straight answer, I think you have to keep pushing until you do get a straight answer. The real straight answer was, he's not going to get any better. The best we could do would be hope to get him off the respirator, and it's not likely. And I think it's very hard to get that information because people don't want to tell you that. They don't want to upset you. They don't want to face it themselves that their treatment hasn't worked.
But that's the part that you have to push.
That's the part.
Yeah.
And I think the other thing that I saw was that without having an advocate, when you go in the hospital, what are your chances of really getting what you need? And it's clear to me that without an advocate, I think you're just rolling the dice about whether or not you're going to come out of the hospital with seeing how broken and fragmented the healthcare system is, and that you need an advocate that's involved every day and as much as possible. And I can remember, in fact, at one point where I slept in the hospital and I slept in the room with my father. He was scared, and they kept on wanting to come in and draw more blood, and they couldn't get the blood out. And there were a number of times I just needed to kick him out of the room and say, no, this is not going to happen right now. And so one of the things that I see that is just mandatory for anyone that goes in the hospital is that someone needs to be identified as being the advocate. And if you need to rotate and have people take that task, that's critical. And to just trust that the doctors know what they're doing and that your family member is in a reputable hospital and they know what they're doing, and you don't need to get involved, is just being the fool if you think that the outcome out of that is going to be that your loved one's going to walk out of that hospital alive. We need to break the process of our own denial and our own fears about our own mortality, and we've got to be willing to suck it up and basically start the dialogue with our aging parents. We're potentially going to be burdened to take in their honor and to talk about what their wishes are and what they want to do. And there needs to be talk among the siblings about the adult children about, how are we going to handle this before the shit hits the fan?
What do we tell our kids about us?
That was one of the first things that happened with us after this experience, because we have 2 grown children. And I said to my kids, I hope you understand that Dad and I don't want artificial means. I don't know what drugs will be available by the time we get to the point, if we ever get to the point, where we're in a hospital and someone is making decisions about what to give us. But if my heart stops, and I'm 89 years old, I want you to let it stop. If I have a surgery that doesn't work and I'm declining and my body systems are failing and they tell you that, I want everyone to get out of the way. And I want you both kids to be very clear. Mom doesn't want to be fixed up, propped up, and kept for a day longer with anything artificial. I want you to just keep me comfortable. I want you to make sure that I have fluid in my veins. I want you to make sure that all of you can be there if we're in that situation, that's possible. And I want everyone to get out of the way, because I'm not afraid of the end of the life cycle. And I don't want you to be afraid of it. That's what I told my kids.
Go.
When the time is right, I don't want any artificial means of sustaining my life. And I don't want them to do anything that's going to stop the process. And I think it's a difficult discussion. We're blessed that the burden that became something that was the nightmare that I never wanted to have happen. I think the blessing that came out of that with my father's death was our ability to be forthright with our own children about this. And even more so, I think both of our passion, both from a professional point of view and from a humanistic point of view, wanting other people in the world to maybe learn from our lessons so that they don't have to replicate what we did and can learn from our experiences so that they can do it even better than we did it and can do it without the pain and suffering that we had to endure. And that's my wish that will come out of this.
Seems like a good place to stop.
Thank you.